Hello everyone. Firstly, I'd like to thank you all for your continued support and cooperation at this challenging time. As I mentioned in my last video, the situation around the COVID-19 pandemic and our response is changing daily, so I will be doing short videos to provide updates as needed. In today's video, I'm going to cover new testing arrangements, the use of PPE, school closures and carers leave. The guidelines have now changed around COVID-19 testing. If you're a health worker or aged care worker and have acute respiratory symptoms, that is shortness of breath, cough or sore throat, you will be tested. If you have any of these symptoms, you should exclude yourself from work, contact your doctor and arrange to be tested for COVID-19. You should not return to work until you've had a negative test result. I know there are some staff members who'd like to wear surgical masks at work. I reinforce that aged care workers do not need to wear PPE when providing your services if they had no close contact with a confirmed COVID-19 case in their facility. Masks are only to be worn as indicated by transmission-based precautions. It is not appropriate for staff to routinely wear masks during their daily work activities. The inappropriate use of masks will also deplete our emergency stocks so that they may not be available when we really need them. In relation to school closures, the state government has announced that Monday the 6th of April to Thursday the 9th of April will be pupil-free days in all South Australian government schools and preschools. School holidays will commence on Friday the 10th of April. It's been suggested that government schools will only be open for the children of essential workers at the start of Term 2, but we've had no confirmation of these arrangements as yet. We'll let you know as soon as we know. Private schools may have different arrangements, so please check with your child's school. If you do have school-aged children, you need to start planning now for your childcare arrangements. Carers leave is for the care of sick or injured members of your household and for emergencies. You will not be eligible to use your carers leave for school closures. You can access annual leave, long service leave or leave without pay to look after children not attending school, but only if it doesn't interrupt business requirements. Leave will not be granted unless there are extenuating circumstances. We need you to come to work, so please do everything you can in advance to arrange childcare. In these unprecedented times, it's important to try to manage our anxiety and not to pass it on to residents or colleagues. Unfortunately, there's a lot of misinformation circulating, and it's important for us to give our residents the facts, calm their fears, and talk about the precautions we are taking. We must continue to remind our residents that the various measures we are taking will reduce their exposure to the virus. This includes the recent restrictions on visitors, ensuring that staff are healthy to come to work, and avoiding the unnecessary use of masks. We need to keep things in perspective and stay calm and positive. We are working hard to protect our residents and you against COVID-19. We need everyone to look after each other. I know this is a tough time for everyone. It's easy to succumb to fear in the face of uncertainty. If you're feeling anxious, I suggest that you read and follow the 10 tips to reduce COVID-19 anxiety that I sent to you by email on Monday, the 23rd of March. I also want to remind you again that our Employee Assistance Program is available to you and your immediate family through Access programs. You can pick up a brochure in your staff room, speak to your supervisor for more information, or call Access programs on 1300 66 77 00. The community needs you at this important time. Our older people deserve the best care we can give them. We cannot abandon them. Aged care is an essential service, and we need to do everything we can to keep going in these very difficult times. The board and I can't thank you enough for the work you are doing. If you have questions, please speak to your supervisor or site manager. If they are unable to answer, they will let you know who you should speak to next. Thank you again for your cooperation and for your commitment to the health and safety of our residents and each other.